Wave continues to grind toward the fall. The latest numbers offer some hope, though, that the curve may be flattening. The state still not out of the woods. 1,215 newly confirmed or probable cases of COVID reported today by the Minnesota Department of Health, and that is the lowest daily count in 3 weeks. 13,160 known active cases right now, with 663 people currently hospitalized in Minnesota. 72.2% of residents 16 and older have at least one vaccine dose. Today, 9 deaths were reported. So our participants on today's conference call format for the briefing, familiar by now, Minnesota Department of Health Commissioner Jan Malcolm, the Commissioner of the Minnesota Department of Education, Dr. Heather Mueller, and a licensed school nurse by the name of Ann Lumbar Benson. Also, the Vaccine Equity Director, Dr. Nathan Chomolo, and the Infectious Disease Director for the Minnesota Department of Health, Kris Ehresmann. We expect to hear from all of them on today's call. That's what we are told. It sounds like Commissioner Malcolm has begun here, so let's listen in live here on NPR News.
New cases of COVID-19 and unfortunately 9 additional deaths. This brings our cumulative total to 664,459 laboratory-confirmed cases, and 7,874 of our fellow Minnesotans lost to COVID-19. There's been a fair amount of fluctuation in the day-to-day numbers, and as you know, yesterday we released a number of days' data altogether, given the weekend and the holiday reporting schedule. So we find it most helpful to look at the daily average over the past week, which has been 1,867 new reported cases per day on average over the last week, and a weekly total of 13,075 cases. The most recent 7-day average rate of new cases on a population basis, that measure that we often cite as comparable to what's going on around the nation, that most recent 7-day average rate is now 29.3 new COVID cases per 100,000 Minnesotans. That's significantly above our high-risk threshold of 10 cases per 100,000. But that 7-day average rate of increase has gone up 5% higher than this time last week. So the slightly good news is that the rate of increase has been slowing a bit. More on that later. We reported 663 Minnesota COVID-19 patients in the hospital as of yesterday, including 178 in the ICU. Hospital admissions are fairly stable compared to last week, averaging about 79 daily admissions per day, compared to 76 per day the week prior. ICU admissions are also fairly stable this week, holding at 16 average daily ICU admissions this last week. As Dr. Chomolo will comment further, it's just important to note that among our highest social vulnerability index quartile, the rate of hospitalizations is up to 29% higher than is true for the rest of the state. And we need to make more progress toward narrowing this very persistent and worrisome disparity. Test positivity is high and steady statewide at 6.6%, with all regions above the 5% test positivity caution threshold. Of all the specimens that we've done whole genome sequencing on since the middle of July, nearly 99% have been the Delta variant. And as mentioned, the statewide week-over-week increase continues to go up, but to go up at a slightly slower rate over each of the past 4 weeks, and that's a bit of a bright spot, relatively speaking. But we do remain concerned about the growth of cases in school and child care settings and the broader implications that has for more cases in those settings and community transmission. Nationally, the American Academy of Pediatrics has reported that 252,000 pediatric cases were diagnosed in the United States in just one recent week. And that was 26% of all the cases added in that week that were among those under 19. Here in Minnesota, our number of school-related cases among both students and teachers continues to increase. And as you know, we are just beginning the school year. A cumulative total of 27,306 cases have been confirmed in the school setting, including 9,193 staff cases and 18,113 student cases. There's some good news on the vaccine front, however. You saw news earlier this week that more than 3,000 people got vaccinated at the state fair. And our latest data show that just about 3,150,000 Minnesotans have now completed their full vaccine series. That's up nearly 3,300 from just the previous day and up by almost 25,000 people so far this month now fully protected from a full vaccine series. And with that, I'd like to ask Dr. Chomolo to give us an equity update.
Thank you, Commissioner Malcolm. So looking at Minnesota's most recent vaccination data by race and ethnicity, with a reminder that the way this data is reported lags by 1 week, as of August 28th, vaccine coverage with at least one dose among Minnesotans aged 12 plus is highest among those identifying as Asian Pacific Islander, with overall first dose coverage rates of 79.5%. Since May, Black and Hispanic communities have consistently seen the highest gains week over week, and their first dose rates among those 12 plus currently sit at 58.2% for Black Minnesotans and 64.5% for Hispanic Minnesotans. First dose coverage for white Minnesotans aged 12 plus is at 67.1%, and for American Indian Minnesotans is 56.1%. Regarding our place-based equity metric using the Social Vulnerability Index, or SVI, over the last week, cases, hospitalizations, and deaths remain overrepresented in Minnesotans who live in zip codes classified as high SVI zip codes, areas where communities are at a disadvantage due to historical and persistent underinvestment. Though residents of high SVI zip codes make up 29% of Minnesota's population, they make up 32% of cases, 39% of hospitalizations, and 38% of deaths due to COVID-19 as of this week. Similar to the overall population, the impact has been greatest among children who live in high SVI zip codes, with children younger than age 17 who live in high SVI zip codes in Minnesota experiencing 42% of all COVID-19 hospitalizations to date in their age group. When looking at vaccine coverage by SVI zip code quartile, coverage remains lowest among Minnesotans living in high SVI zip codes. Statewide, vaccine coverage is at 71% by first dose for 12 plus, while 68.3% of Minnesotans living in high SVI zip codes have had their first dose, compared to 75.6% of Minnesotans living in low SVI zip codes. I now have the privilege of putting on my DHS Medicaid Medical Director hat to share an update on COVID-19 vaccination among Minnesotans covered by our Medicaid program. Over the last month, we have worked to supplement our Medicaid claims data with MIC data to get a fuller picture of the COVID-19 vaccination status of Minnesotans enrolled in medical assistance, Minnesota's version of Medicaid, and Minnesota Care, our state's basic health program providing low-cost health insurance option to people who don't have access to affordable employer-sponsored health insurance or have higher income levels than those eligible for Medicaid. Together, Medicaid and Minnesota Care make up our Minnesota healthcare programs and currently cover over 1.38 million people, more than 1 in 4 Minnesotans. Low-income and Medicaid enrollees have known barriers to access care that can also impact their ability to get accurate information about COVID-19 vaccination, and other states have reported disparities in rates among those enrolled in their Medicaid programs. Our analysis is a snapshot that looked at all MHCP enrollees age 12 plus who were enrolled as of June 30th, 2021, and we find that COVID-19 vaccination rates are far lower among MHCP enrollees than among Minnesotans as a whole. As of June 30th, only 40.4% of MHCP enrollees were fully vaccinated versus 64.1% of Minnesotans statewide, and 44.5% had at least one dose versus 67.9% statewide. This disparity is seen at every age, racial, and ethnic demographic group, and the odds of an MHCP enrollee being vaccinated for COVID-19 varied significantly by age, race, ethnicity, disability waiver status, county, and social vulnerability of residential zip code. Enrollees were more likely to be vaccinated if they were aged 50 or older, and least likely if they were ages 12 through 17, with only 28% of eligible children on Medicaid having started their series as of June 30th versus 41.5% statewide. Black and Native American enrollees had the lowest vaccination rates, while rates among Asian Pacific Islanders were notably higher than in any other group, similar to the patterns we see in our statewide data. Vaccination rates among MHCP enrollees varied widely by county within Minnesota. Generally, county-level rates appeared to be lower in central Minnesota and higher in the 7-county metro area when compared to the rest of the state. And there were two encouraging signs of analysis that point to some of the work that DHS, MDH, counties, our managed care organizations, providers, and community partners have been doing to reach our neighbors enrolled in MHCPs. When we look at enrollees by SBI quartile, we found that while 42% live in a high SBI zip code, the gap between enrollees in high SBI zip codes and enrollees overall was much less than we see between Minnesotans in high SBI zip codes statewide. Second, we looked at enrollees who are served by waiver programs for those with disabilities. In Minnesota, people with disabilities who need certain levels of care may qualify for MHCP waivers, which currently include our brain injury, community alternative care, community access for disability inclusion, and developmental disabilities waiver programs. Just over 5% of enrollees age 12 plus had one of these waivers. Enrollees who received benefits through a disability waiver were significantly more likely to be vaccinated than those who were not on a waiver, and in fact had vaccination rates that were higher than the statewide average, with 69% of enrollees having at least one dose versus 67.9% statewide. This is the only population we looked at within MHCP enrollees that held that distinction. And while disability waiver status was associated with age, with those on a waiver tending to be older than those not on a waiver, significant differences in vaccination rates persisted after adjusting for age. A snapshot brief with this data and additional analysis is now available on DHS's Medicaid Matters page, as well as on DHS's homepage under Latest News. We've already started sharing this data with counties, tribal health directors, managed care organizations, and other stakeholders, and we'll be notifying providers of this data to help inform their ongoing outreach and work at the clinical level to help our Minnesota Medicaid enrollees get access to these life-saving vaccinations. And with that, I'll turn it back to Commissioner Malcolm.
Thank you for that update, Dr. Chomolo. With this week marking the start of the school year for many of our kids, we're particularly appreciative to be joined today again by Minnesota Education Commissioner Dr. Heather Mueller and our special guest, school nurse Annie Lombard-Benson, to provide some updates. As we did a couple of weeks ago, we also just want to keep reinforcing some key prevention messages that can help schools and students get the school year off to a healthy and successful start. A very recent CDC report provides additional evidence of the threat to children posed by the Delta variant and the value of community vaccination to prevent illness in those too young to get vaccinated yet themselves. This study, cited by CDC, looked at trends among children and adolescents and found that since July, after Delta became the dominant variant around the country, also true here in Minnesota, the rate of new COVID cases and COVID-19 related emergency department visits and hospital admissions increased for people under 18. I mentioned earlier the data cited by the American Academy of Pediatrics on just the rapid rate of increase in cases overall. But among children 0 to 17 years during the last 2 weeks of August, which was the period that the CDC examined, they found that COVID-related emergency department visits and hospital admissions in the states with the lowest vaccination coverage were 3.4 and 3.7 times that in the states with the highest vaccination coverage, respectively. These data absolutely indicate that the decisions of others in the community, whether to mask, whether to vaccinate, whether to stay home if sick, these things matter not just for the person or their immediate family, but for the entire community, including our school population. With a highly infectious disease, the decisions we make as individuals don't just affect us individually. They have ripple effects that go deep into the community. including our schools and those under age 12 who haven't yet had a chance to get vaccinated. And we do know, all of us, how important in-person learning is for students. And we need to take the right actions to make that in-person learning possible and safe. And to do that, we need to use all the tools in our prevention toolkit. And that means that layered prevention approach that we've talked about often, including that all people ages 12 years and older should get vaccinated for COVID-19. All students, teachers, staff, and visitors in school buildings should wear masks indoors, regardless of their vaccination status. Schools should maintain 3 feet of distance between students within classrooms whenever possible. And students, teachers, and staff should stay home and get tested if they are feeling sick. You've heard these messages many times before, but I want to focus just a bit more on the masking recommendation today. It's just a basic message that bears repeating. Masking reduces transmission of COVID, period. Your mask protects you and those around you. One person wearing a mask indoors is some level of protection, but a classroom or a school full of people wearing masks is better protection. Masking is just an excellent complementary preventive measure in addition to vaccinations for everyone. And for those under 12 who can't be vaccinated yet, universal indoor masking is particularly valuable in a school setting. I mentioned on previous calls that CDC produced an updated science brief resource a couple of months ago that consolidates some of the research backing up the effectiveness of masks. And I really encourage anyone with questions about this to check that out by going to the CDC's website, cdc.gov, and search for Science Brief Masks. And we can also be informed by the lessons that are being learned around the country. We hear stories every day from more and more states, more and more school districts around the nation, and we see more and more media coverage of this. Lessons like the story from Marin County, California, where a teacher went to school with symptoms, didn't mask, and ended up infecting half of the kids in the classroom. And these examples show how decisions big and small, decisions by school leaders, superintendents, school boards, principals, but also decisions by individual teachers, coaches, students, and parents can have big impacts. This Delta variant spreads easily, as we've talked about, and it's more important than ever that we use our available tools to slow transmission, especially as we start this very important school year. Anyone eligible for vaccination should get that protection as soon as possible and follow the CDC's guidance for continued masking, distancing, and other prevention strategies to help avoid the widespread illness and community impacts that we have seen so often. We also encourage schools and families to take advantage of the testing resources that the state of Minnesota has made available. As we shared last month, schools now have a variety of testing options available to them as they work to develop local testing programs to keep kids and staff healthy, safe, and in the classroom. This school year, schools have access to individual PCR tests, pooled PCR tests, and rapid tests, both antigen and molecular. You can learn more about these various test types on the MDH website. Districts, charter schools, tribal schools, and non-public schools will all be able to assess which tests work best for their school community and have some autonomy in developing their individual testing program. But offering testing in schools is strongly recommended given the rise in Delta cases. And our Department of Education is also providing much-needed grants to support testing efforts in schools. With that, I'd like to invite Commissioner Mueller to share her thoughts at the beginning of the year here.
Thank you, Commissioner Malcolm, and as always, we really appreciate your expertise and the partnership that we have with our Minnesota Department of Health colleagues. Like Commissioner Malcolm mentioned, as we kick off the school year, MDE is standing with our colleagues at the Minnesota Department of Health in reminding and urging school boards and school leaders to adopt local policies and implement mitigation strategies that are multi-layered and that follow the health experts' recommended best practice requirements. I know that these issues are polarizing. The decisions have not been easy, and many of our school communities have experienced extremely contentious school board meetings. Just like we did last school year, we are urging our schools to do everything that they can to prioritize in-person learning for our students. That includes adopting local health and safety policies like what the Department of Health put forward as recommendations to require universal masking, reporting, quarantining, and physical distancing. We are partnering with MDH to make sure that our schools have the tools that they need to keep our students, staff, and families healthy and safe. And again, you heard Commissioner Malcolm talk about those COVID-19 testing resources from both the state of Minnesota and the federal government. As we announced over the summer, we are excited to be able to provide free in-school screening testing options for all of the schools that we've identified, our school districts, our charter schools, tribal schools, and our non-public schools. And as was mentioned, the testing program really builds on Minnesota's first in the nation statewide in-school testing program that we launched during the school year last year. This time around, however, schools will have more options so that they can choose the very best tactics in their communities based on their local needs. Like we said, it includes things like free test kits, grants that are available for schools that are implementing a testing program, and those grants can include things like supplies and staffing support for administering tests and other testing-related needs. I do encourage every school to take advantage of these resources. While many of our students aren't yet eligible for vaccine, testing is a good way to stop the virus in its tracks before it even has a chance to run through a school building. I also want to take a moment to talk directly to our families and remind them that the recommended health requirements from the Department of Health and the CDC are also helpful for you as you send your kids to school. It's important to be aware of what your local school is doing to protect the health and safety of your students, staff, and your families. Also, please know that no matter what your school's plan looks like, we recommend that you get your students vaccinated when they're eligible. They take part in the regular COVID-19 testing and reporting of your positive cases to your school. Make sure that your child wears a mask on the bus and in school, regardless of their vaccination status. Stay home when your student is sick, and skip high-risk activities. By following these science-based best practice recommendations and requirements, we can all help minimize the interruptions to our students' learning as we navigate this third school year that is being impacted by the pandemic. Now, as we know, this week as many schools are returning to the classrooms, I've had the opportunity to visit a few schools around the state, and it has been wonderful to greet our students and staff and to watch how excited our students are to see their teachers and to reconnect with their classmates. We must all do our part to make sure that these students get to have the kind of school year that they deserve. Not only is safe in-person learning extremely valuable to our students academically, as well as their social, emotional health and their mental health, we also know that it is an incredibly valuable place for our students to interact with other adults who care deeply about them, to provide nutrition services, and to get physical health support and services. And one of those adults who cares deeply about our students is on the call with us today. School nurse Annie Lombard-Benson is here to talk about what she is seeing in her community and how we can all help to protect our students, staff, and families.
Thank you so much for the opportunity to participate in this call with you today. It really is a distinct pleasure to be here as I hold both of you commissioners in high regard, and I'm grateful for the work that you do on an ongoing basis. Additionally, I always appreciate the opportunity to sing the praises of the school nurses across the state who are truly doing some heavy lifting throughout this pandemic. COVID has certainly added an additional layer to the responsibilities of school nurses on top of all of the other things that we already did. I often say that when school nurses do their jobs well, we tend to be very invisible because we help to reduce barriers for students to ensure that they can fully participate in their educational programming. And COVID has really thrown all of that into disarray, requiring time and effort to contact trace and educate and help parents access resources and educate some more. Yet at our very core, we are public health nurses who are committed to the public health of all. And I just want to acknowledge that people are tired and weary from dealing with COVID. I get it. We all wish it was behind us, but unfortunately, we're not there yet. I also think there is some collective fatigue and nebulous grief that goes along with this, as we don't have a clearly defined end date when life can continue on in a new normal way. We had a definite beginning, but there is no clear end, which makes it really difficult as you have to function in that unknown. I also believe that we all have the same goal in mind, as we know that kids learn best when they are in person, and that has been challenged over these past few years. What we really need is for parents and families to rally around our schools in an effort to prioritize and continue in-person learning. School staff are working so hard to mitigate and reduce risk as much as possible and have done an amazing job of adapting and adjusting our response as we learned more throughout the changing COVID landscape. But it really will take all of us and take families doing their part, as our measures alone will not ensure a successful school year. We need the support and commitment of parents and families. Because here's the thing, COVID doesn't just happen in isolation and affect one child. It has that ripple effect to the child's household, the child's grandparents, their cousins, friends, and beyond. Especially with this Delta variant, we are seeing multiple members in a family testing positive. This is not occurring in isolation. As Commissioner Malcolm and Commissioner Mueller both indicated, the more layered prevention we can undertake, the more likely we will be to continue in-person learning. This means that we need community engagement and support. These include wearing a face covering, especially in vulnerable situations, getting vaccinated when you're able, staying home when you're ill, that consistent and regular testing, and social distancing between you and others that are not part of your household. Again, I just want to thank you for having me and thank you for your tireless work. We are in this together, and if we can continue to provide multiple layers of protection, as it's not just one specific thing that is the magic wand, so to speak, we'll be able to move through this together as a society. With that, I will turn it back to Mike.
Thank you very much. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press star, then the number 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Bill Werner from Minnesota News Network. Your line is open.
Hi, thank you very much. I think this is a two-part but very closely related question that it may be for Commissioner Mueller and then for Commissioner Malcolm as well. Do we have any idea what percentage of Minnesota school districts have policies requiring masks in the classroom, and are there any sort of trends in that area that you are seeing? That's the first part of the question. And then Commissioner Malcolm, you're, I'm sure, aware of what the governor said yesterday in Rochester about he shares parents' concerns about a patchwork of local school district policies on masks in the classroom. He said there is no plan at this time for him to mandate masks in schools, but if the situation warrants, he'll take a re-look. I understand that would require a redeclaration of a peacetime emergency, but are we anywhere near where the State Department of Health is asking the governor to consider that route of action? Thank you.
This is Heather, and so I will hop in on that first part of your question. As you know, that schools have been modifying and adjusting what their masking requirements are, as well as their other layered mitigation strategies are as the school year has started. And so at this point in time, we have not collected the information about what each of the requirements are. That is something that we will be gathering the information on and then giving us the opportunity to partner with our health colleagues to see if there are what the correlations are, if any, based on what we see in cases as well as what we see in some of those masking policies. And so as schools begin to get into their rhythm, that's where we'll begin to gather that information.
Do you have any idea, Commissioner, how soon you might have some useful data in that area? Is it a number of weeks away or a number of months away, or what's the timeline?
Well, we're hopeful to be able to have the information about what the layered mitigation strategies are looking like within the next week to week and a half. And then we'll have to, again, work with our health colleagues to determine what those correlations look like, especially as schools start.
Very good, and we'll wait for that. I imagine you'd be sharing that with us then. Thank you.
Thank you.
Yeah, thank you, Commissioner Mueller, and that will be important information to be able to give that feedback to our school leaders in our communities. Bill, to your second question, as you know, the governor has said repeatedly that at this point, without the peacetime emergency declaration, there isn't that same toolkit available to him to do executive orders under his powers in a peacetime emergency. And he's further said that given where we are in the pandemic, given the discussions at the end of the legislative session, those conversations really need to involve the legislature more and more. Even if he was to declare another peacetime emergency related to COVID, as you know, the legislature has to have a chance that he only can do that for 30 days at a time, and the legislature then has to come back to give them an opportunity to either approve or, more precisely, if both bodies disapprove the peacetime emergency, then it cannot continue. So he has said these conversations really need to be with the legislature at this point in time. And we will be keeping a close eye and coming up with recommendations that we think the legislature should consider around where we are in the pandemic and what community level mitigations might make sense. So that is something we're, I would just say, picking up the pace of our conversations about what some of those issues might be.
Are you anywhere near close to recommending some sort of a masking requirement in schools specifically, or in other areas, as a means of, in other words, opening that discussion with the legislature? Might it happen as soon as possibly a special session, whenever we get to that? If it's this month, might it be that soon?
Well, I would have to say, that we, as Commissioner Mueller has said, we're really appreciate the hard work that local school leaders are doing, and we recognize the difficulty of some of those conversations. So the idea of a statewide approach to that certainly would be on the list of issues that we from the health department's perspective would suggest would be a good thing to discuss with the legislature. But that is, there are a lot of steps in that process, as you know. So I think, as I mentioned earlier in the call, we're, definitely watching our statewide trends closely. We're glad to see a little bit of slowing down of the increase, but just going into the school year at this high level of case transmission, we think it's very important to just stay really attuned to the data and ready to act should we need to.
Thanks, Commissioner, and thank you, Commissioner Mueller, also.
Next question comes from the line of Catherine Richard from Minnesota Public Radio. Your line is open.
Sure. So I'm wondering if you have any insight into how many contractors in Minnesota will be affected by the vaccine mandates Biden is expected to announce today. Do you have any numbers on that?
We don't. I don't, at least right at hand. That might be a good question for our colleagues at Minnesota Management and Budget. We could certainly pose that question and follow up with you.
Okay, thanks. And then I was hoping you could actually be a little more specific about what you're seeing among kids in schools and daycare that is concerning to you. Are you seeing specific clusters of cases breaking out? What is it exactly that has caught your attention there?
Yeah, it's definitely just kind of the rate of increase in the number of cases and the number of settings that we're seeing cases arise in the recent weeks. But Kris Ehresmann's on the line with us, so I would ask Kris if you have more to add there.
Thanks, Commissioner. I'll just add that when we look at where we're at right now, say compared to where we were last fall, first of all, we're seeing a higher number of cases than we were seeing at this time last fall. And then when we look at hospitalization, so the proportion of cases in children who are being hospitalized, last fall it was about 0.7% of cases, and now this fall we're seeing about 1.3%. So the good news is that still is a relatively small number of cases in children that are being hospitalized, but the concern is that is doubled from what we saw, the fall before. And so, as we think about more kids back in school, our elementary school students unable to be vaccinated, those are the things that are giving us pause. And so that's why we're looking at the data so carefully, and that's why the two commissioners have re-emphasized the importance of layered mitigation.
Sure. And if I could just clarify something, last fall, kids still weren't in school in parts of the state. There was a lot of distance learning going on, a lot of hybrid. I mean, I guess I just want to be clear, if I'm explaining this as a reporter, is this a function of Delta, or is it a function of the fact that kids were just less exposed this time last year?
It's probably a little bit of both, but I do think that, Delta is so much more infectious than what we were seeing a year ago with the wild type strain. So, we've used the example that in 3 generations of transmission with the wild type or the original strain, you might have 27 cases, and with Delta, that would be 343. So, just much, much more infectious. So it's a combination of things. And we had, just to be clear, for those students that were in the classroom, there were many more mitigation strategies that were in place because of the executive orders. Over.
Got it. Thank you.
Next question comes from the line of Eric Newland from the St. Cloud Times. Your line is open.
Yeah, hi. I had a question, a quick clarification for Jan Malcolm. You mentioned the total number of pediatric cases of COVID-19 in Minnesota. Was that 27,306? Was that a cumulative total since the start of the pandemic in 2019?
Yes, I believe that is back to the very beginning, but Kris can correct me if there was a different start date for collecting those pediatric cases. Kris, can you clarify?
Yeah, no, you're correct. Back to the beginning.
Yeah, and then as a follow-up, I was wondering if this school year, will the Department of Health be reporting pediatric or cases in school settings in any other way in addition to those, the weekly list of schools with a certain amount of cases per 14 days, that weekly school list that we've been seeing in the reports every day? Will there be any additional school-related, additional reporting of school-related cases this year?
Kris, can you take that one?
Yeah, no, we will continue to be reporting as we did last year related to schools and pediatric cases.
Okay, thank you.
Next question comes from the line of Emily Ness from WDIO News. Your line is open.
Hello, thank you for taking my question. I was wondering if you guys have any updates on when booster shots will be available for the general public.
Well, this is Kris Malcolm. That's certainly something that we are awaiting guidance on from the federal level, from both the FDA and the CDC. As has been reported widely, we're expecting that we might get information on that, very soon, in the next week and a half or so. And there's been a lot of speculation about what those recommendations might be, whether it will be, the same booster shot for everyone of every age, or whether that will be more, kind of specific to different age groups at different times. We're awaiting that level of detail. And expect it at least to get sort of an update on what that timing might be in the next week and a half or so. But Kris, do you have anything more recent to share?
Well, just to say that, what we've heard, and obviously, as everyone is aware, things change so quickly, and it's a very fluid situation. But certainly, we're hearing that the focus may be just for Pfizer because that's where there's sufficient data. We've also heard that ACIP may be looking at more of a risk-based recommendation. So in other words, if you're over a certain age or if you fall into a risk group. So there's all of those things that, as the commissioner said, we're really waiting to get more clarity on. And then the other thing to keep in mind is that up until this point, all the conversations about boosters have included, a time frame since the second dose. And so, although the federal government told us and kind of let people know we should be preparing for September 20th, I think when we look at some of the time frame scenarios, like in 8 months, if that would be used, that would mean that for the general public, most people wouldn't be eligible to receive a booster until well into October or much later. So just want to make sure that we're keeping that in mind as well. But as the commissioner said, there's so much that we're not sure about right now, and we're waiting to hear from the FDA. And they do have a meeting scheduled, I believe, next week. Over.
Okay. Thank you.
Operator, we have time for one more question.
Next question comes from the line of Lizzie Agnelli-Eri from Fox 9. Your line is open.
Hi there. My question was answered. Thank you.
All right. That is all the time we have for today. We invite any reporters with additional questions to reach out.
Well, and you have been listening here on NPR News to a live briefing from the Minnesota Department of Health from Commissioner Jan Malcolm, the Director of Infectious Disease, Kris Ehresmann. We also heard from Dr. Nathan Chomolo, who is in charge of vaccine equity for the department. The Education Commissioner at the start of school on Dr. Heather Mueller on that topic. And then we also heard from a licensed school nurse by the name of Annie Lumbar-Benson with the briefing today. A couple of notes from today's briefing before we return to the BBC and remind you we'll have more on all things considered online at nprnews.org. Right now, the state stands at 29.3 cases per 100,000 people, and the area of concern is 10 per 100,000 people. Positivity rate at 6.6%. Usually there's concern over 5%, and 99% plus of the specimens that are being examined are the Delta variant. There's also concern as well about the rate of increase when it comes to students and school-age children. So the key to that, according to Education Commissioner Mueller, is both testing, frequent testing, and vaccination, and also kids following those CDC and Minnesota Department of Health guidelines, including wearing masks on the bus. We also heard from Dr. Chomolo about some numbers concerning the racial makeup of those who have had COVID and also who have gotten vaccines, because that is his concern as vaccine equity director for the state. And the highest category the state is keeping track is AAPI, or Asian Americans, Pacific Islanders, at 79.5% of the first vaccine, or at least the first vaccine. And for African Americans, 58.2%, for Hispanics, 65.4%, for white Minnesotans, 67.1%, and for Native Americans at 56, a little more than 56% as well. So we'll continue to follow the COVID-19 story and bring you the latest and any briefings as they occur here live on NPR News. But again, the BBC World Service News Hour will rejoin in progress and bring you All Things Considered at 3 p.m. Stay with us.
Just for the phone. When the North Tower collapsed, the hotel was evacuated down a back stairs